good evening, everyone. Welcome again to our Q&A Wednesdays with J. Lopez, MD. So for tonight's topic, it will be interesting. It's entitled Taking Charge of Your Health in This Pandemic. So it's still important that we take charge of our health. And by the way, I'm Dr. Bella Espino, junior resident physician at J. Lopez MD, and I will be your host for tonight. Before we start, I want to introduce you to our two guests and doctors for tonight's discussion. First, Dr. Sigfried Galang. He's a graduate of St. Luke's College of Medicine, practicing integrative medicine. And at the same time, he is also a medical acupuncturist. Let's welcome Dr. Sigfried Galang.
Hi, Dr. Bella.
Hi, Doc. So before we start, Doc, and to complete the team, I want to introduce our next doctor. He's a graduate of FEU NRMF and a US-trained integrative medicine physician, a certified nutrition specialist, and also a diplomate of the American Board of Anti-Aging and Regenerative Medicine. And our very own wellness doctor, Dr. Joel Lopez. Hi, Doc Joel. Hello.
Hi, Bella. Hi, Sigfried.
Hi, Doc.
Hi, Doc.
Thanks for the introduction.
You're welcome, Doc. So,
Hi.
how are you guys tonight? Are you excited for our discussion, taking charge of our health in this pandemic?
Yeah, it's a very interesting
Yes.
topic. So.
It really is, and it's very, very important in this time. Actually, anytime we should take charge of our health, right? But since it's gonna be ECQ again, and really we need to take into consideration how we take care of ourselves. So let's start our discussion. I'll give the floor to you, Dr. Joel.
Thank you, Dr. Bella. So for tonight's topic, again, it's called Take Charge of Your Health in This Pandemic. First off, I would like to acknowledge the FLCCC organization. Most of the information that we'll be sharing to you tonight would be coming from this group. And this FLCCC actually stands for First Line COVID-19 Critical Care Alliance. It's a group of medical doctors. Actually, most of them are critical care specialists that have organized these protocols to help physicians all over the world in how to deal with this pandemic. So next slide, please. So before anything else, I just would like to mention this because this really is very appropriate at this time. And actually, it's Albert Einstein who did say this. And I would like to quote him. And he said, doing the same thing over and over again and expecting different results is a definition of insanity. So in this pandemic, it's really important to really be open-minded and accept criticism and have a critical mind, or it's important to have critical thinking. It's important to think independently so that we'll be able to achieve better results when it comes to treating not just this infection, but any type of infection for that matter. Next slide, please. So this just describes to you the course of COVID-19 and our general approach to treatment. As you can see here, there's the incubation stage in which the virus is already replicating, but person may be asymptomatic. The second stage is the symptomatic phase, in which the virus is still continuing its replication stage. And during this stage, the inflammatory process actually is beginning to start. Then we have the third stage, which is the early pulmonary phase, and finally the late pulmonary phase. So If you know the stages, you'll be able to actually think about what supplements or medications to recommend to your clients. Like, for instance, if a person is in an inflammatory phase, that would be the third or fourth stages that are shown here, then antivirals would not be the best type of treatment. In the same way, during the replication stage, giving an anti-inflammatory medication is not the best thing to do. In fact, it's going to cause more harm if you give anti-inflammatories during the viral replication stage. So it's really important to know the stage that a person is in so that you'll be able to recommend appropriate treatment. If you look at the under stage 2 symptomatic phase, the symptoms include fever, malaise, cough, headache, and diarrhea. These actually are symptoms that a person is undergoing an inflammatory phase. So it's not just important to recommend antivirals during this stage, but also institute the use of natural anti-inflammatories or immunomodulators. And the things that we use for this purpose include vitamin D3 and other nutrients such as melatonin. So these things help the body prevent what we call a cytokine storm. Next slide, please. So I did mention already the timing or the initiation of this anti-inflammatory therapy. So ideally, it should be initiated during the early pulmonary phase as well as the late pulmonary phase. If you see here on the bottom of this graph, the inflammatory response is a little bit low during the first two stages, which is the incubation and the symptomatic phase. But as the inflammation goes higher or gets worse, that's when you begin to institute the use of anti-inflammatory medications. In the hospitals, of course, they use dexamethasone or budesonide, but in outpatient practice, we use anti-inflammatory supplements such as turmeric, ginger, or omega-3 fatty acids. Next slide, please. So the FLCC Act actually devised different protocols to address different phases of treatment. There's one called pre-exposure prophylaxis. There's one called post-exposure prophylaxis. Then there's early treatment as well as late treatment. It's really important to institute treatment as soon as a diagnosis is made. And it's really important to have a high index of suspicion when it comes to seeing clients or patients. Because we've had a case in our office in which this is like, I believe she's like in her mid-60s. She only presented with fatigue. So no other symptoms, like no respiratory symptoms. So we did have her tested and we found out that she was positive for COVID-19. So we instituted treatment right away, and eventually she did get better. And the program that we put her on include the use of supplements such as vitamin C, D3, zinc, quercetin, as well as other immunomodulators such as melatonin, and also the use of transfer factors. And of course, in our practice, we also recommend different kinds of services that are actually helpful, especially if a person has moderate to severe symptoms. This would include the use of intravenous nutritional therapies, which Dr. Sigfried would elaborate on later, as well as oxygen therapies. Next slide, please. So these are the different protocols that FLCCC has created, and they include Math 1, which is something that we really don't use because this is one that's made for hospital use. Then the second one would be IMESC, which is more for prevention and early treatment protocols for COVID-19. iRecover are for those people who are long haulers. And then finally, there's IMAS, which is, again, prevention and home treatment, and as well as for mass distribution protocol for COVID-19. Next slide, please. So the eye mask protocol is primarily for prevention and early outpatient treatment. So next slide, please. So this shows the different mechanisms of action of one of the most widely used medication for COVID-19. It's called IVM. And for those who don't know what IVM is, it's actually ivermectin. It's actually an anti-parasitic drug that has been repurposed for the use of or treatment of COVID-19. It's got several mechanisms of actions, and they include, number one, it prevents the entry of the virus into the cell. Second, it prevents the entry of the virus into the nucleus. Third, it actually interferes with this replicase enzyme that is important in the transcription and translation of the viral proteins. Then there's also one mechanism of action, which is an immunomodulatory mechanism, which actually prevents your cytokine storm. Then another one would be the prevention of this DIC, or disseminated intravascular coagulation, by interfering with this P147 receptor in this viral protein, in this virus. And then finally, the production of interferon, which is it's a substance that's produced by your monocytes that has antiviral properties. So as you can see, based on these 6 mechanisms of action, it would actually be appropriate for use at any of the stages of this COVID-19. So next slide, please. This is hard. I could hardly see this. It's so little. But anyways, for prevention, what we normally do is, of course, we give the nutrients such as D3, C, quercetin, which is a zinc ionophore. Quercetin is a bioflavonoid that helps with the entry of zinc into our cells. And zinc is the one that really prevents the replication of the virus within the cell. The dosages vary for each individual. Ideally, you want to have your vitamin D levels tested, but if you cannot do that, it would be safe to take between 2,000 to 4,000 IUs of vitamin D3 daily. For vitamin C, it's 500 to 1,000 milligrams twice a day. We could go up to 6,000 milligrams a day as tolerated. Quercetin, 250 milligrams up to 1,500 milligrams a day for a short period. Then zinc in elemental form, that's from 30 to 40 milligrams a day. And then, of course, there's melatonin at 6 milligrams before bedtime. Ivermectin could also be given for high-risk individuals at 0.2 milligrams per kilogram per dose. And for those who have post-COVID exposure prophylaxis, it'll be the same dosage, actually. For early treatment, we do recommend this ivermectin for 5 days, up to 14 days, depending on the severity of a person's symptoms. Fluvoxamine is usually given. It's actually an SSRI, and it's actually something that penetrates the blood-brain barrier. What it does is that it has anti-inflammatory properties as well. Then nasopharyngeal sanitation using betadine and other substances such as essential oils. Then, of course, this dosages of vitamins D3, C, zinc, quercetin at a higher dose compared to the prophylactic dose, as well as melatonin and aspirin. And for those who are leery about taking aspirin, they could take like turmeric or other things that like nattokinase or lumbrokinase. Okay, next slide, please. And by the way, as you can see, it's really important to have this behavioral protection as well. Um, that would be the use of mask, of course, social distancing, and frequent washing of hands. Um, so for this next one, it just gives you the dosages for this ivermectin. And of course, it's really important to work with your doctor when you try to obtain this medication for treatment of symptoms attributed to this COVID-19. Because there are contraindications to the use of medications, and that I would just mention uh, that it's one major contraindication is for liver cirrhosis, basically. So next slide, please. So this one just gives you the program that we recommend for mass distribution for people who are exposed at work, or for those people who are who may need early treatment at home, and then those for people who have been exposed to the people around them. Next slide, please. So this iRecover protocol is basically recommended for people who are long haulers. These are people who have symptoms that persist beyond the regular or the usual period of about 3 to 4 weeks. Oftentimes, these people experience different symptoms such as fatigue or brain fog. And of course, there are different approaches depending on the doctor that you see. For instance, for brain fog, uh, usually the doctors in FLCC would recommend fluvoxamine, which is an SSRI. In our practice, we do recommend, let's say, hyperbaric oxygen therapy, as well as nutrients that would help improve your circulation to the brain, such as your ginkgo biloba, acetyl L-carnitine, and Bacopa monnieri. These are things that could possibly help with the brain fog. And then, of course, there's fatigue. We usually may recommend nutrients such as coenzyme Q10, L-carnitine, as well as intravenous nutritional therapies. Next slide, please. Next slide, please. So we now go to the topic of vaccination. Oh, but before that, would you like to share, Dr. Sigfried, about the services that we actually do at the office to help
Yes.
improve a person's immune system?
Yes, Doc. Yes.
Okay. Yeah, so Ralph, would you mind switching over to Doc Sigfried's PowerPoint presentation? Would you like? Yeah, go ahead.
Okay,
Hello?
for the question and answer portion, we'll reserve it after the discussion for today. Go ahead, Doc Sigfried. Floor is yours.
Thank you, Doc Lara. Okay, Doc, thank you, Dr. Joel also. So we have the immune enhancement that we can use in our services at J. Lopez MD, Medispa and Wellness Center. Next. So we have hyperbaric oxygen therapy. So with oxygen, we are able to introduce oxygen to the cells with under pressure. So it improves the oxygenation of our cells and the tissues. So it increases the energy production, especially of the white blood cells. So it enhances the activity of the white blood cells. At the same time, there are bacteria that doesn't like the presence of oxygen, like the anaerobic bacteria. So with the presence of oxygen, they also die. So do you have any additional inputs with hyperbaric oxygen?
Yeah, with
We could
hyperbaric
discuss it.
oxygen. Yeah, go ahead.
I'm sorry.
So in addition to that, since it has a lot of oxygen, it can also produce oxygen radicals, which can actually harm the bacteria with hydrogen peroxide. So this can also help inhibit the bacterial growth. So for example, we use hyperbaric oxygen when we're treating also wounds, like those wounds that doesn't heal. Those from diabetics, for example, they have diabetic gangrene, so they use also hyperbaric oxygen therapy to treat gangrene wounds.
Yeah, and how long do you stay in the hyperbaric chamber?
You can stay there for an hour. So there's just an additional time for compression and decompression.
Mhm.
So it's like when you're flying the plane. So there's like ear popping. You have to just equalize both ears, and then also there's of course the pressure there is increasing, and it can cause warm. That's why we have to cool it first, the room, so that it's
Mhm.
cooler. So it's like diving around how many feet, Doctora?
It's
Like
around 15 feet seawater.
yeah, 15 feet.
Yeah.
It's like diving under the sea.
So our hyperbaric chamber can go up to 1.5 ATA.
Mm, yeah. So that's
Okay.
how the hyperbaric oxygen therapy can help assist one from enhancing his immune system. So with the presence of these abundance of oxygen within the cells, within the tissues, and the blood.
That's really interesting, Doc Sigfrid, with the
Yes,
hyperbaric oxygen therapy.
yes. So there's another therapy treatment that we use next. Okay, so this is IBU, so the extracorporeal blood oxygenation and ozonation. So this is very familiar to Dr. Abella and Dr. Joel, the
Yeah,
ozone.
and
Yeah,
we did a webinar about this a
yeah,
couple of weeks ago, and
yeah.
everyone should check it out for more information about ozone, and especially this treatment that we offer here in the clinic called EBU.
Yes. So how does it work for our immune system? It's actually inactivates. So the medical ozone, which enters which mixes with the blood, inactivates the bacteria, the viruses, the parasites, the yeast, the fungus. So it works on by destroying the bacterial cell membrane of the bacteria, and also for the fungus or the yeast, it inhibits the cell growth or the growth of the yeast cell. And also for the virus, it breaks down the viral capsid. So it's like kind of disrupting the reproduction also. So in the presence of peroxidation coming from the lots of oxygen coming from the oxygenation of the blood also. So it's a very safe procedure. So I have done ozone too. It helped me when I had an illness, COVID illness. So I came from a COVID illness. So this is one of way of helping me to recover. So Dr. Joel discussed about the I recover. So
Mhm.
for recovery from post-COVID. So sometimes I had fatigue even after the illness is gone for a long time. I think I had it from April, so now I am recovering because of the EBU, also in hyperbaric oxygen therapy.
Okay, and also this ozone therapy is not only good for what you've discussed, Doc, but it's
Mhm.
good for the circulation as well. You know,
Yes, definitely.
to bring a good flow to our blood circulation.
Yeah. Okay. So,
We have.
Doc, you have an
Mhm.
input with EBU?
Yeah, so it's really good for cellular healing as well as cellular oxygen utilization, such that it's being used to help improve like cardiovascular issues. So for those with cardiac ischemia, this is something that would really help them. And for those who have problems with, let's say, degenerating disc or joints, what EU does or medical ozone does is that it stimulates the release of growth factors that would help in the healing of these um, joints and discs.
Okay, that's great. Okay, so next treatment. So one of my favorite too, the infrared sun, especially right now it's always raining and it's very cold outside with the weather. So it's nice to heat up our body. So how does infrared sun helps us with our immune system? It's kind of like mimicking the fever. So with fever, actually, my advice to my patient is not to give paracetamol or antipyretics at around 39.5 or below 39.5 degrees Celsius, so that we allow the immune system to work and destroy this bacteria and to be activated. So, like in the infrared sauna, we're actually increasing the temperature, core temperature of the body. So, and also it also inactivates enhances the immune system and inactivates the bacterial growth in the body.
Yeah,
Any input?
what you said, Dr. Siegfried, is really
Mm,
interesting because the
yeah,
protocol right now among the conventional medical circles is just to send the patient home once they're diagnosed. And they're just given supportive treatments like, let's say, fluids or antipyretics. So,
mm,
fever is not bad. It's something that our body uses to actually get rid of infection. So, ideally, we shouldn't suppress that because if we do, that's removing one of the ways that our body takes care of this harmful microorganisms. But what, like you said, when the temperature is like really high, that's when you only institute the use of antipyretics.
that's correct.
Yeah.
Okay, and at the same time, it helps to detoxify. So through the sweat, we can release some of the toxins that our bodies accumulating or harboring. So like heavy metals and even the toxic waste that the bacteria has produced inside the body or the virus inside their body. So it's actually good for colds, common colds also. Those who have the flu symptoms also can also assist in recovering faster from the illness. Doc Bella, do you have any input?
Not right now. Later
Okay,
with the questions that after the all the discussions.
okay. So we go next to the next treatment. It's a J. Lopez, MD. Okay, so this is the intravenous infusion or night nutrition therapy. So that boosts the immune system. So we actually use vitamin C. The vitamin C, so the vitamin C itself actually enhances the activity of the immune system. So actually, it's the white blood cells that has a lot of vitamin C in it compared to the plasma of the blood. So so the white blood cell needs the vitamin C in order to be effective in combating viruses or any foreign body that is creating havoc in the body, like some bad bacteria. Of course, there's also good bacteria. So I'm talking about the bad bacteria and the opportunistic ones, and also parasites. So we have the high dose vitamin C, and we have also the bio-oxidative drip, which is actually made of hydrogen peroxide. So this is very effective for flu, and sometimes we also use the mixture of vitamin C and hydrogen peroxide. We call it the mini C oxy drip. And Dr. Joel is really using it also in his clinic in America, in San Francisco, the mini C oxy drip. And also another one is the Immune Boost IV. So it's a concoction of Myers with an increased number of vitamin C inside in combination with vitamin Bs and other antioxidants.
Doc Sigfrid, when you say high dosage of vitamin C for our viewers, how what do you mean by it?
So actually, we are providing more than just 500 milligrams of vitamin C that we take orally. So by passing it through the blood, we are actually giving around could be around 10 grams up, 10 grams of the vitamin C. So we're talking about the sodium ascorbate. Um, So this would, by increasing the sodium ascorbic, we are actually also increasing the production of the hydrogen peroxide. So it's the hydrogen peroxide that kills the bacteria, and also the inactivates the other microorganisms in the body through the use of hydrogen peroxide. At the same time, vitamin C is needed for the adrenals against stress, and also for cortisol production, and also for collagen production. So
Mhm.
it like increases the immune system. As I said, the white blood cells really need this vitamin C inside their body, the cells, in order to be effective. So if you are lacking vitamin C, then your immune system is very, very low and weak.
Okay, thank you, Doc
Well,
Sigfried, for that. Is there Are there any more treatments that
yes,
our clinic
yes.
offers?
Yes, usually when somebody's in IV, we also include the ear acupuncture and other acupuncture treatments. So next slide. So there, so while a person or a client is under IV, or patient is under IV, so we also add ear acupuncture to the treatment, so it complements the detoxifying, the immune boosting. It also calms the mind, detoxifies the liver, the kidneys. So we can use a different protocols for the ear acupuncture. So the research study on the side, it's a Japanese study in 2009, and it proves that the acupuncture can actually have an effect on the immune system by immunomodulating the the different types of white blood cells, and also the the complement system. So it increases the number of white blood cells, the innate cells, the humoral system cells. So innate immunity and humoral immunity, these are both important
Mhm.
for responding to an infection, like for example this SARS-CoV-2 infection or flu infection, or even just the ordinary coronavirus and rhinovirus infection. So this could be a complement to the existing treatments that we're also doing at J. Lopez MD. Okay. Then actually in China, in Wuhan, China, they have used acupuncture in conjunction with herbal medicine. So I think you're familiar with lingua. So they also include other herbal medicines there. So here in the Philippines, we're much more familiar with our own herbs and also our own supplements. So we can combine it with acupuncture also.
So, Dr. Sigfried, it's not only ear acupuncture. You
Yes,
can
yes,
also do full body
yes,
acupuncture
yes, definitely.
for this a part, which is a part of a service that we could offer for uh, illnesses. Is that correct?
Definitely, definitely. So there are points in the body that actually improves when you use that point. Improves the boosts the immune system.
Okay.
So there's some in the legs also. Most of them in the leg.
That's really interesting,
Yes,
correlating traditional Chinese medicine in the current, given in this study, the current scientific,
yes, it's
scientific
scientific.
medicine.
So it's just not just like
Mm.
anecdotal. Yeah.
Okay, Dr. Joel, do you
Yeah,
want to say
I
something?
was gonna
Mhm.
say that in the olden days, the traditional Chinese medicine doctors would actually strengthen the immune system of each person, because if a person would get sick, they would not get paid. So they have
Yeah, it's
great
preventive.
incentive
That,
to
yeah.
really keep the patient well. So ideally, that would be the same approach, because if you strengthen the immune system, then our body would be able to fight off any type of infection, rather than rather than coming up with like a lot of, let's say, new drugs to test on or to treat infections. When you keep the immune system healthy, then you don't need to invent a lot of treatments just to um, address new infections.
Mhm.
Yeah.
Actually, I highlighted the word immunomodulation because this is very important, especially
Mhm.
in these times for COVID. Because the one that actually kills one is when they have COVID is actually the
Mm.
hyperinflammation reaction of the immune system, which we call the cytokine storm. So
Yes.
with acupuncture, it can actually modulate by decreasing the inflammatory markers and increasing the anti-inflammatory markers. Just like what D3 is doing, melatonin is doing also.
Mm.
Okay, so we go to the next treatment. Next slide. Okay, so aside from the IV, so we have also the our line of Vitale Vitale line of products, and this is the different Vitali products, but I'm focusing now on the Vitali Immune Pack or VIP, which includes the Vitali Core, the Core HC, the Vitali Forte, and the Vitali Reach. And of course, in addition to that, we'll add also the other treatments the doctor said earlier, like ivermectin, the vitamin C, and D3. Although Core HC is vitamin C itself. Okay. So next slide. So for Vitaler Core HC, so this is just to compare the difference between a synthetic and natural. So in what Vitaler Core HC actually is made up of natural vitamin C source. So it's made of camu camu extract, which is the highest vitamin C source in the world. So as compared to the synthetic, natural has a lot of um, additional factors that is not found in the synthetic, which is just part of the natural antioxidant wrapper of the vitamin C. So with the presence of these factors, it is able to give more benefits than just the synthetic sodium ascorbate or ascorbic acid. But of course, definitely this synthetic ascorbate has their own benefit, but more you can get from natural sources of vitamin C. Okay. So next slide. Okay, for the Vitale Forte, so I'm just showing you a presentation here of the 10 essential oils in the Vitale Forte, which includes the different oils there. So it's very small for me to read, but um, different oils there has effect on the different mechanism of entry of the virus, especially the SARS-CoV-2. So there are essential oils that blocks the entry of the virus on the cell surface, and then there are essential oils that blocks the replication and the multiplication of this virus before it can go out of of the cell. There are also essential oils that blocks it. So these 10 essential oils in the Vitale Forte actually is a complete antiviral, a natural antiviral in a bottle or in a capsule. Okay, so next. Okay, so for Vitale Reach, the purpose of the reach in the immune system is actually to provide the building blocks for the production of antibodies and also for providing the building blocks of protein, which is made of the antibodies, and also for the immune system to be stronger with the natural nutrients that comes from the premium spirulina. So it is made of premium spirulina, and it has, you can see the nutrients, how high the nutrients is compared to the other vegetables and fruits in the list there. Okay, so that's Vitale rich, so very rich in nutrients. Okay, do you have any inputs, Dr. Abella, Dr. Joel, with our
For
Vitale?
for our
Vitale.
viewers, yeah, for our viewers, we actually also have a webinar about our Vitale line, which they could watch for more information.
Mhm. Okay, that's great. Okay, so next slide. Okay, so with all the treatments there and here, with J. Lopez MD, it's really very important to get to the root cause of the problem. So with a consultation with the doctors, um, the patient can understand more what is happening in the body and can be given the right advice and right prescription. Especially there are contraindications with the medicines, And even if it's natural, also herbal, there's also some needed advice, interactions between drugs and even supplements. So, and in the right dosage. As Dr. Joel said in the past slides, there's the right timing when giving certain medications or drugs during the phase of the infection, if it's in the inflammatory or if it's in the viral replication stage. There are certain drugs that we do not give and give during that time.
Great.
Okay.
Okay. Dr. Joel, are you
Are we
going
going
to?
to get about that too? About the um, preparation prior to vaccination?
Yes.
Oh, we could touch about that. Yeah.
Yeah. So, Ralph, could you please go back to my slides?
We actually have a question already, but we'll tackle it right after.
Okay.
This one, I'd like to give credit to the IFM, Institute of Functional Medicine, where I got this slide from. So, this is the pandemic pre vaccination protocol. So, again, it's really important to individualize treatment and also to get informed consent from the patient. It's really important to educate people so that they'll be able to make wise or really um, wise decision when it comes to vaccination. So, of course, aside from the public health measures such as mask, social distancing, and hand washing, these are the things that we actually do recommend prior to uh, a person getting vaccinated. It's really important to address lifestyle factors because certain conditions um, may create a really inflammatory state in our body. So we want to really lower this inflammation by addressing this comorbidities, and I'll mention those later. But as far as like improving your chances of getting a good response from the vaccination, it's really important to get adequate sleep. It's important to get regular exercise, pay attention to your diet. Uh, um, in this case, you want to go more on an anti inflammatory or alkaline diet. It's really important to address stress. And then, of course, make sure that you have good relationships. It's also important to pay attention to your gut health because it's also important for your general immune system health. Um, These are options to improve physiological function. Uh, Ralph, do you mind zooming in on this? So these are things that you could actually improve physiological function. These are antioxidants and anti-inflammatories as well as immune modulators, such as curcumin, resveratrol, quercetin, and melatonin. Then you could also include things such as green tea extract, glutathione, and acetylcysteine, andrographase, as well as berberine. And for conditions below, it's really important to address this before getting vaccinated, making sure that these symptoms are really well controlled, such as hypertension, diabetes, CVD, hypertriglyceridemia, hyperinsulinemia, autoimmunity, and obesity. People with this comorbidities are in high uh, pro-inflammatory state. So you want to make sure that you address these issues before getting vaccinated. And then, of course, there are nutrients that help improve immune function, and these were some of these were mentioned earlier. But in my practice in the States, we use a high dose of vitamin A for a few days, especially for respiratory infections. Then, of course, there's your C, which a lot of us have heard about during the last year or so. Vitamin D3 is not only a vitamin, it's a pro hormone as well. It actually helps our body modulate our immune system function as well. Then there's vitamin E, B6, B12, folate, iron, zinc, which is the antiviral that we use, especially for those who are getting treatment at home. It's important to look at your copper levels as well if you're taking high doses of zinc. And then, of course, there's selenium, which is important for the production of your glutathione molecule. Mushrooms are a good source of your beta glucans, also important for immune system health. Echinacea has been used traditionally for respiratory infections like the flu. And then, of course, there's quercetin, which is a bioflavonoid that's been used as part of this CD3 and zinc program. That's uh, treatment that we recommend for COVID as well as for prophylaxis. And then there's resveratrol. Then if vaccination is weeks to months away, it's important to address this lifestyle and dietary issues as well. To enhance immune function, make sure you go on an anti-inflammatory or an alkaline diet consisting primarily of plant-based foods. Address inflammation by taking nutrients that would calm down inflammatory processes in the body, such as omega-3 fatty acids, ginger, turmeric, or curcumin. It's important to stop smoking and, of course, lose some weight because people who are obese have a lot of inflammation in their body. Addressing stress is important as well, and so is physical fitness, mind-body therapies, optimizing your dietary fiber intake, optimize your microbiome, address autoimmunity, and address hormonal imbalance as well. A lot of these things we address just with our regular clients, but for those who are really serious about optimizing their health, you gotta do all these things. For those who are scheduled for vaccination, like within a few days, it's important to avoid acute stressors. And ideally, 3 days prior to your vaccination, it's important to really get enough sleep. Avoid anti-inflammatory agents 2 days pre and post vaccination. And if there's an active infection going on, postpone the vaccination to another date. So those are things that we could do to help our prepare our body for this medical procedure. So I think that we could discuss about vaccines, the different kinds of vaccines, in like on another time. In the meantime, we're now open for question and answers from our
Q&A.
viewers.
So we got a question. I think Doc Sigfried, you can answer this. From Mr. Nino Sumagio. Is the sodium ascorbate form okay, or ascorbic acid is better than sodium ascorbate?
Okay, so sodium ascorbate actually comes from ascorbic acid, so they're just the same. It's just that we add bicarbonate to the sodium ascorbate to the ascorbic acid to become alkaline. So for those who have gastric upset when they're taking ascorbic acid, which is more acidic, so we can have an option of using sodium ascorbate.
Yeah, and one thing, ascorbic acid is the isolated form of vitamin C. It's really important to try to get the whole food-based form of vitamin
Yes,
C. That's what we have in the core 8C.
correct. Yeah.
If you
So
look
that is
under,
better.
yeah, if you look under the microscope, the structure of the isolated form of vitamin C is different from the whole food-based vitamin C. And like for any supplement or medication, if you isolate it from the whole herb or plant, it becomes more of a drug. So there are more cases of side effects if you isolate a vitamin or a nutrient from its original form.
Okay, so what about the IV nutrition that we do? What form is it?
Well, yeah, we use sodium ascorbate in
Sodium
our
ascorbate.
IV. Yeah, in our for our IVs, and of course, it would either come from corn or beet sources. We normally would prefer beet because there's less um, GMO beet compared to
Of
corn.
course, yeah.
Yeah.
Okay,
So
that's
the advantage of having IV vitamin C is that it bypasses the digestive tract.
Mhm.
So you can get vitamin C in your blood immediately rather than taking oral. But it's also good to combine the two. Like when you have IV vitamin C here in the clinic, then you can take your oral capsule of vitamin C in at home. So you have continuous levels of high levels of vitamin C to protect you as prophylaxis and as an early treatment.
so for those who um, can't buy the ascorbic acid or sodium ascorbate, do you have any alternatives for that, like food?
Yes, definitely. They can buy our local citrus fruits. So there's the bayabas, no, the guava is very high in vitamin C. So there's also papaya. So just not too much because of the sugar.
Okay, so for the supplements, it's it's not only the supplements that we buy, but we can also found these vitamins and nutrients from food, right?
Yes. But the problem with food right nowadays is the vitamin C deteriorates as it is stored
Mm-hmm.
longer in the grocery. So it's better if you pick it up from the tree. So, but the longer it stays on your cabinet or in your kitchen, it deteriorates. And
Mm-hmm.
if you cook it, also it kills the vitamin C also. If you cook it.
So for Dr. Joel, you explained the course of illness in COVID. So
Mhm.
do you mean that the treating COVID is a stage or phase specific treatment?
Not necessarily because a lot of the symptoms overlap. So
Mm-hmm.
actually, you could recommend those those supplements that boost the immune system, such as C, D3, and zinc, as well as quercetin, even in the inflammatory stage. Because, like for C, it has anti-inflammatory properties. The D3 has immune modulating properties. So the effect is not just confined to one phase of the COVID or the SARS-CoV-2 life cycle.
Mm-hmm.
Yeah.
Um,
Of course, you can use this as prophylaxis to prevent any type of infection, and it's also being used for treatment. But let's say using, let's say, zinc alone during the inflammatory stage may not be sufficient. It's really more important to focus on the anti-inflammatory nutrients during the inflammatory stage.
okay, that's good to know, Dr. Joel. With regards to ivermectin, is it okay to take it alone than taking the whole protocol? How effective or it is, or um, is it uh, okay to not take the other supplements?
I believe that we should approach this in a holistic manner. So I don't want to rely on just one supplement or medication alone, because if you combine it with different nutrients, you'll be able to target other, let's say, target other mechanisms through which the virus replicates or through which the virus causes uh, pathological issues. So I would recommend a holistic approach, including an anti-inflammatory diet. It's really essential to do that, and of course to pay attention to the basic things that we normally take for granted, like getting adequate sleep, in which we actually produce melatonin, which is a regenerative and healing hormone. Then, of course, getting sun exposure, which is a source of vitamin D3, which stimulates the release of antimicrobial peptides, which is why it's effective against the flu and other types of infections.
Yeah. So I just want our viewers to know that in our clinic we do a holistic approach to manage and treat our patients.
Mhm.
For Thank you, Mr. Joel Manansala, for your support. For the IV drip, for others, they may ask how frequent should you do the IV drip, and can you do it? Can you have an IV drip while you have an ongoing infection?
Yes, definitely.
Yeah, definitely.
um,
Uh,
yeah,
How frequent? Yeah.
before we recommend high dosage vitamin C, though, we have to make sure that we do this G6PD test, just to make sure that they don't react negatively to the high dose vitamin C. And in our practice, we could do it as often as every day, if needed, because there are protocols. I believe they're done in China and other places in the U.S. in which uh, patients who were actually admitted were given intravenous vitamin C, like I believe it's like 6 to 25 grams, like once or twice a day for like 5 days. Yeah.
yes, I
Okay.
remember that last year. Yeah, they did that. That's why
Yeah.
their patients recovered
Mhm.
after giving those vitamin C drips.
Yeah,
Mhm.
yeah.
Yeah.
There are even
Um,
studies showing that they used like really high doses of vitamin D3, as much as 60,000 units per day for
Mm.
5 days. And it really sped up the healing or the recovery of these patients who had serious infections. I believe it's called the SHADE study.
oh, okay.
Yeah.
That's for our viewers. You could Google that study to read more about it. Um, Doctors, do you have any more to say before we end? We actually are almost an hour
Yeah.
Okay.
to our webinar. Do you have anything to say before we we end our webinar?
Yeah, I
So I
think,
think
Uh-huh.
go
mhm.
ahead.
Doc Sigfrid?
So I think with all this information that we shared, that I think our people, especially the Filipinos, um, can take charge of their health, and they have a lot of options to take care of their health in terms of immunity, creating natural immunity when they're exposed to the virus. So that is the powerful immunity that that nature has provided for us.
Yeah, and then
Okay.
I read something by Marilyn von Savant. It's she said that to acquire knowledge one must study, but to acquire wisdom one must observe. So
Mm.
when the pandemic was just starting, all we needed to do was what the authorities told us to do. But now, since we have more experience, we've got more observational studies, I think it's time we approach things from a different standpoint. We know better now than what we knew like a year ago. So now I think there are a lot of things that we could recommend to everyone to uh, survive in this and thrive in this pandemic.
Exactly, doctors. So, from Flor Evangelista, I just want to say this. I just want to thank you all for my fast recovery when I experienced symptoms of COVID-19. Thank you, Miss Flor.
Thank you.
And thank you everyone for staying with us with an hour of webinar. Um, okay, so to summarize, taking charge of your health, we discussed protocols that everyone can follow. Of course, everyone is unique. And also, we also discussed treatments that we could offer here in the clinic, and other protocols that we recommend to our patients. It's not a one size fits all treatment for everyone. And also, from what Doc Joel said, he mentioned that we need to go back to basics. So basics is the lifestyle that we do, the foods that we eat, hand washing, regular hand washing, movement and exercise, and also adding supplementation in our routine. Um,
And good
and
sleep.
and good sleep. Yeah, I forgot. Thank you, Doc Sigfried. Um, so everything is incorporated in a holistic approach to your health, and everyone should take charge of our health, because it's the only gift that God has given to us, and we should really take care of it, right? Um, and so that's how I would end our webinar. If you have any questions and concerns for our viewers, you could call our office. We have a link down at the what's this
At the bottom.
description box below. And also, you could check our website, jlopezmd.com, for more information about what we do, um, and also what we offer in our clinic. With that, I invite you to also check our other social media accounts like Facebook, YouTube, and Instagram. Follow us and subscribe, everyone, and so that you could be updated with what we do. So thank you, everyone, for
Thank
being with us. Thank you, Doc Joel, and thank you, Doc Sigfried.
Thank
you,
you
Good
Bella.
too.
night, everyone.
Thank you.
Thank
Thank you.
you. Good night.
Good night.